the March 28th minutes. Let me see why. No, I'm sorry.
I was
With
not
the 25th, we have the 25th. And the reason we do is I was there with Mr. McSweeney and Ms. Demore, and we had two members who were away. So I'm going to ask that for a motion to postpone July 25th minutes.
I'll make a motion to postpone July 25th, 2023 minutes.
Thank you. I have a motion by Ms. Demore, second by
I'll second.
Ms. Sheehan. All in favor? Aye. 400 for postponing the July 25th minutes. We're going to go on to the March 28th minutes. It looks like we have enough people. Are there any corrections, omissions, deletions, additions? No? If not, could I have a motion for approval of the March 28th minutes?
I have to abstain because I wasn't here for those.
You have to abstain.
I wasn't here for those minutes, right?
Yes. So I'm looking to my colleagues on the left to make a motion.
Motion to approve.
Motion to approve by Ms. Sheehan, second by Ms. Welch. All in favor? Aye.
Aye.
301. Correct? Okay. 301 with Ms. Demore abstained. All right, which brings us to citizens' time. Is there anybody here who's not on the agenda? Is anybody on cable access who would like to speak to this board who is not on the agenda?
We don't have anybody on.
Nobody on? We're all set? Good, we'll go through that. Subcommittee reports. I do not believe there are any subcommittee reports. Oh, chairman's report. How could I forget? It's that time of year again. The kids have gone back to school. The New England Patriots are back on the gridiron, losing. And the trees will still be turning color. And it's flu season. Flu season has begun. While the effects of flu varies, it places a substantial burden on the health of the people of the United States each year. You know, the CDC estimates that between 2010 and 2020, and that's the epidemiological data, the most recent that I could find, that flu has resulted each year in 9 million to 41 million illnesses. Each year, up to 710,000 hospitalizations. And each year, and I know it's an average and it's a range, between 12,000 and 52,000 deaths each year. And I'm going to repeat that. Between 12,000 and 52,000 deaths each year during that 2010 to 2020 period. So, it's time to get your flu shot. You really should get your flu shot. We are holding clinics for both high and regular dose vaccine, or you can get it at any pharmacy, any doctor's office, or where you receive your health care. Now, this is not a political issue. It is an optional immunization. Many of you have gotten the shot in the past. It takes a little bit of time. I got in and out today in minutes when I got my flu shot, and it could save you from getting seriously sick and even save your life. So your life is important to all of us here. Please get your flu shot. Thank you. You can call the Board of Health office to get more information. So that now takes us to subcommittee reports, which we have none, and hearings. A notice to suspend the permit for Board of Health regulations concerning and governing food service establishment Cold Stone Creamery, 2 Wayside Road. Now, according to the state, I have to get a motion to, and I have to do a roll call now, motion to open a hearing. Do I have a motion to open a hearing?
So moved.
Motion by Andrea Sheehan, second by Mary Beth Welch. All in favor? Ms. Demore?
Aye.
Ms. Welch?
Aye.
Ms. Sheehan?
Aye.
And I vote aye. This hearing is now open. And do we have a representative from the Cold Stone Creamery?
Yes.
And would you please sign in?
Yes, Asante.
And please print your name, sir. Okay, because we have a recording secretary who has to transcribe.
Got you, not
So
a problem.
Please print.
Got you, not a problem.
And your name?
Brian Pogue, B-R-Y-A-N-T, last name Pogue, P-O-A-G.
Mr. Pogue, thank you
Yes.
for coming.
No problem, thank you.
Our health agent, Marlene Johnson, will present.
Sure. So Mr. Pogue is before you tonight for a violation of the Certified Food Protection Manager regulation, known as the Burlington Board of Health Regulations Governing Food Service Establishments, which states in part that at least one such person in charge shall be on duty and present at the establishment at all times that the establishment is open to the public and in operation, and that being a person in charge who is a certified food protection manager. The violation history is the most recent, August 2nd, 2023. During a reinspection, Samantha Hardy found that there was no certified food protection manager on site. And then going back to June of 2022, Samantha Hardy found during a routine inspection, no certified food protection manager on site. So what management has done is they registered 6 employees. 5 actually attended the ServSafe class. I happen to be the instructor and the proctor that they were in, the same class that they were in. And all 5 of them were present for the instruction part as well as the exam part. And Mr. Pogue did find out the results. So out of the 5, 2 passed, 3 did not. I do want to point out that even though they didn't pass the exam, that they had the education. Dr. Warner can attest that the exam can be tricky and can be difficult, but they were in the class and they had the education. ServSafe states that a person who fails the exam can't take the exam for at least 60 days anyway, so. And then I'll have Mr. Pogue explain how he's going to make sure that he has full coverage from this point forward.
How you doing? My name is Brian Pogue. I'm the regional supervisor for a few Cold Stone creameries out here. I work for a company called Chicago Scoops. I have 5 Cold Stones out here that I actually supervise right now. My plan is basically simple. Taking over as the manager of the store until we basically find enough people or a lot of people to basically cover all aspects of the store. Right now, with the shortage of trying to find people to work, I have no problem being in the store 24/7. With the other 5 stores that other 4 stores that I do have, the managers also agreed to basically help out a team effort as far as just trying to build a culture, knowing that the situation of the store need people. So days where I'm not here, like right now when I'm not in the store, probably have another staff member from another store actually being in the store, basically serving the shift. Right now, just on Indeed, just trying to find people. Real hard. Y'all lived out here longer than me. I'm actually from New York, relocated to actually help keep the stores open. Just real hard just trying to find people that actually want to work, but up for the challenge, basically. I was told that basically when you get rid of somebody or somebody resign, you gotta let the Board of Health know. That's what basically happened in our situation. With me only being here 9 months, a lot of the things that happened is new to me. But as I was told everything that was happening, we've been fixing everything one by one. So I have faith that we definitely will hire people. We also have special ops in the company where people come from different regions to help out when needed. Of course, I'm gonna need breaks until we find find people, and something that I'm actually trying to work on as well, to try to build a special ops in this region as well, Massachusetts by itself. I spoke to my corporate office, and they feel that's a good idea, considering the fact that it's hard to hire people here. We don't really have that problem in other regions that we have Cold Stones in. So my plan is basically simple. You see me with my uniform now. Just to work until we find the people that we need to be in the stores that's certified. One of the things that we're going to do is when we find people and we feel that they are the people that we want, we will invest in them. Same thing that they did with me as far as paying for me to take the test, making sure that I'm certified, making sure that I'm knowledgeable when it comes to dealing with the food. Because at the end of the day, we want to make sure that everybody that deals with the food knows what they're doing, because it's the health that's #1 priority. So my plan is simple. Just find people that want to work, and I'm up for the challenge, to tell you the truth. I know it's going to be hard, but I'm up for the challenge. I'm willing to work. So,
Thank you.
not a problem.
I've got a number of questions, but please, anybody else?
Marlene, so currently right now, how many picks are, hi, good afternoon, good evening.
All right.
How many picks are employed?
That'd be a question for him.
That's it.
Right now, we have a bunch of people that's employed. As far as people that's active, we have 5, including myself.
And are they all pick certified or just 2?
No, it's me and 2 other people.
So 3?
Yeah, 3 people
picks
altogether, yes.
covering the shifts.
Yeah.
But we'll give leniency for the 3 that took the exam that didn't pass, because they at least have the knowledge, even though they didn't pass the test.
So if you go in to do an inspection,
We're not going to penalize them if one of those people
waiting
is the
to
person in
retest.
charge. Exactly.
Okay. And that's what I thought, Marlene, but
Yes.
thank you for answering
welcome.
the next question.
And those people agreed, they don't know that they failed yet, so I'm going to inform them. And when I spoke to them about it, they agreed to take the test again. They also agreed that they understand that a company paid for it the first time, the second time, they'll have to probably go half. Something that I'm going to do as well as myself is just to invest in myself and my own money as well, because it's something that we definitely need. So they definitely willing to take the test again, going to take the test again, because it's an opportunity that you can't basically let go.
So how many days is the ice cream open?
7 days a week. The only 2 days that we close is Christmas and Thanksgiving.
So how many hours a day?
Our hour just changed. It went back to 11 to 9 on Sunday through Thursday, 11 to 9. Friday and Saturday, 11 to 10.
And so the people that are certified to be there, are they full-time employees? Are they
A lot of them is full-time employees. One thing that I was going to work on is trying to find something where I could actually boost the pay to make the position more appeasing, so we could have more full-time employees. That's one of the difficult things, is trying to compete with the bigger businesses as far as hiring. So one of the things is we're going to definitely boost the pay up to make it more interesting as far as people want to work there and take the test.
It just seems like an awful lot of hours to cover.
Yeah, one of the things we
Just 3.
consider is definitely cutting the hours, probably 11 to 8. I think regulation, we have to be open at 11. We used to open at 12, but we have to be open at 11. If it becomes an issue overbearing on me, because I'll be doing most of the hours, we definitely will cut the hours to probably like 12 to 8 or 11 to 8.
And Marlene, I think kind of piggybacks off what you're saying, for the other employees that are waiting to retest, is there when you're talking about age, working certain hours, how many hours they can work per past a certain?
We don't get involved with that. That's labor law. That would be the management would be following whatever the labor laws are.
Anybody else? Well,
My questions were answered.
thank you very much. First, I got to say this right over, although it's not really on point, is that thank you, Ms. Johnson, for running that class again. It's a difficult class, and it's a bear of an exam. You know, it really is a bear of an exam, and I understand why only 2 out of 5, 40% of the test. But I'll tell you, Mr. Pogue, you're very eloquent, and you sound very professional and very dedicated.
Yeah.
I hope that Cold Stone, I hope you put that into the minutes, please, that the chairman acknowledged Mr. Pogue for being so professional and committed to his job. And then you can get a copy of the minutes to show that.
Appreciate it. Thank you.
All right, because but we just wanted to make sure that you have a written plan. Were you still looking for a written plan, Ms. Johnson?
It would help if you
All
put
right,
together
got you.
a written
All
plan. I
right.
know you sent me an email, but I'm also going to, I had provided him with a list of food consultants. I'm going to provide that to him again, and I recommend maybe looking at a couple of them and just finding some local classes, so that way he can get some new employees enrolled in a local class.
Yes, that would really, because with all due respect, we're here tonight to, if you weren't so good and come up with a plan, we could have suspended your permit to operate here in this town. You knew that.
Yes.
You could take away your license to operate in Burlington. We don't want to do that. For you to leave here with a slap on the hand is a commitment that you put this in writing to her in the next 5 days or so. Would that be all right? 5 days, the next 5 days, 5 business days. A one-page plan how you're going to cover, and then what are you going to do if you don't cover? If you
Gotcha.
can't, you're going to shut down, you're going to put whatever, all right? Because we are committed. This is an international community here in Burlington.
Yeah.
It's people here from all over the world. We need to ensure that even though it's and I don't make to lessen the importance of, even though you don't cook large meals, that your staff members understand safe food management. So I'm willing to, Ms. Johnson, do we need a vote, or do we need just
You do need to. So the action by the Board of Health, the board may vote to either A, take no action if determined by the Board of Health that the food service establishment is in compliance with the Burlington Board of Health regulations governing food service establishments, or B, suspend the establishment's food permit with notice in accordance with 105 CMR 590.014 BG, if determined by the Board of Health that the food service establishment is not in compliance with the Burlington Board of Health regulations governing food service establishments until such time that the Board of Health determines that the food service establishment is in compliance with Burlington Board of Health regulations.
So,
Chairman,
just
can I-
before, could you give a copy of what you just read to our new recording secretary?
At the end, sure.
At the end, sure, thank you. So she can get that. Now, sorry.
Sorry, Marlene, I think what you said earlier, though, and just kind of going back, is there's a grace, you're offering that lenient grace period. So does that have to be included if you step in there within 60
It's actually
days?
serve safe that they can't even take the exam
Right.
for
So-
60
but you
days.
said
So,
we would
right, so we
kind of
would not,
offer-
right, so we would not issue a citation.
There's not a pick and charge.
Correct,
If we walk
because
in within 60 days, right?
Those three, so we
Yeah.
know those three took the class. If there was somebody that was there that didn't take the class and is not certified, that's a different story. They would get a citation. We're just talking about the three that took the class but didn't pass the exam.
And if they're there, kind of like
During a routine inspection,
they would.
we
have
would
a
not
grace
issue a
period.
citation.
Okay. I
Yes.
didn't know if that had to be in any type of, do we have to document any of that? That we're giving that grace, that they're there and they haven't passed?
So it's up to the inspector's discretion on whether or not to issue a citation
Yep.
anyway.
So we already said what we're
in,
gonna do.
in this case, if the inspector felt that the person knew the information, however, just didn't pass the exam, then I think what she's saying is that they would be considered trained, maybe not have the official certificate, however trained.
So they could still be a PIC?
Yes, well,
In training, as you said, right?
A person in charge.
certified
kinda like, yeah.
protection
Yeah.
manager training.
Okay.
And part of the philosophy around that, the issue around it is you can give them, you're allowed to give them that grace because of issues.
Correct.
The other, they can't take the exam for how long? 2
For 60 days.
to 60 days.
Right.
So we have to give them a grace period of, let's say, 120 days, something of that sort, because
This is
Yeah, so
normal
I think,
practice.
so what the
right?
board is here to decide is, okay, is because the certified food protection manager coverage is very difficult to try to decide whether or not they're in compliance, right? So the board is here to decide, are they in compliance? with our local regulation, having certified food protection manager present at all times, or are they not? So if you, the board, consider those 3 people who are in the training to have the same amount of knowledge as somebody who passed the test, then that would mean that they would have, 5 out of 6 employees that they currently have would be trained?
Right, and he also mentioned that he's having other people that are certified cover his store as well, to make sure he has full coverage.
So I want to give them a certain time period. I don't want to come back next year.
So you want to make sure that they pass the test?
Somebody
I think we need some.
Well,
Yeah, and I wanna know when
caution
we're going
against
with that.
that, just because what if they don't work there anymore? You know?
Yep.
But that just
food
means-
service, there's such a high turnover. The regulations state that when we go in and do our inspection, there needs to be a certified food protection manager. So, you know, the next time we go in there, that's what we're looking for. We're not looking for those 3 people to find out if they passed or
I
not.
understand, but a year from now, if you go in there and one of those 3 people didn't pass, is the pick. I want,
They should be
it's an
certified.
issue.
They
There's-
should
I
be
don't think
certified
that,
by then.
that's kind
They've
of a moot
expired.
point. The point is, if you go in there again, and whoever is, if they're not certified, they're in violation again. And I agree with that.
After 60 days,
After
yeah.
60, she's giving that,
So you're giving them how long? So how-
ServSafe gives them 60
60 days.
to retest.
But,
Yeah.
so my question would be, when is the town of Burlington going to surprisingly show up within the next 60 days to validate that there is somebody?
He's going to provide copies of the certification. So it's his responsibility as the manager to make sure he has full coverage. So he needs to make sure that they take the test after the 60-day period and that they pass. And if they don't, then he needs to either hire somebody, move people around, do what he needs to do.
So my issue is that 60-day wait 60 days, I understand that, and then they have to find a course, which is not easy, although they're on the internet, and then they have to take the class, and then they have to pass the exam, and then they have to wait for results for a good 2 or 3 weeks. So we're talking about 60, and then another 30 days, 90 to find one, and then another 30 days to take the test to get the results. So I would like 120 days maximum.
And that's only for those 3 people. Because I understand exactly where you're coming from as far as the people that failed the test.
That's twofold. One, if she goes in there and no one.
Yeah, I understand that,
You
yeah.
gotta
Most
get
definitely, yeah, I understand that part.
But if she goes in and one of those 3
Yeah.
people are in charge, then they should have passed within 120
Yeah,
days.
basically, any new hire that we come in, they should be served safe,
So
yeah.
it's twofold.
Uh-huh, gotcha.
One is those 3 people,
Those- yeah.
120 days, and the other is if they go in and those people aren't there,
Yeah,
no, there's nobody.
Exactly, yeah,
So-
I
and
understand.
this is the first that I've heard that they have the knowledge, they're trained. Not saying disagree.
In this particular case,
Yeah,
correct.
for me, it's,
Yep.
and being in the board, this is the first. So that's why I was asking for kind of, what's the grace period? And you said it kind of goes past retaking the test, getting prepped to retake the test, getting the certification.
Yeah.
Okay, so do you want to put a condition?
Yes,
Go
please.
with A,
Yeah.
so,
Would that be all right?
Yeah,
say-
I agree with you.
Yeah.
okay, so within 120 days
Of those
to
3
provide
people.
certification, or if they get transferred
Yeah.
or leave or terminated, then you need to let us know that too. Okay.
And again, Ms. Johnson, please provide our new recording secretary this information, because there's been a lot here.
Right. Susan, can we email her the information? Because I have
Yeah.
notes on my copy.
And
Okay.
please email Mr. Pogue too. He should have,
Thank you.
he should have the data. All right?
He has it.
Okay.
Received all of it.
So we have a motion that you prepared and well, we have to make a motion, but you have a model motion plus conditions.
Right.
Does that sound okay?
Yep,
So do I have a so moved motion
so moved.
by, Ms. Welch, second by? Second by Ms. Demore. All in favor?
Aye.
400.
Thank you.
Is there anybody opposed? I didn't do that. Are you opposed?
I'm not opposed.
400. Thank you.
So just to be clear on, just for the motion for Julie, it's it's A, to take no action, because you determine they're in compliance, so long as the 3 people, if they're still employed, are trained within, or receive a certificate within 120 days.
Correct, or
Get that, Julie? Yeah, okay.
someone else needs to be in charge either.
And I'll send you.
Absolutely.
There are 2. So if they go in and one of these 3 people, they have a 120-day grace period. But if they go in and they're not there and nobody's there, they're in violation too. Is
But
that,
also, he was going to write a
And he-
plan, a written
oh.
plan.
Yeah, and I have to write within 5 business days.
Plan
Yes.
for this. Okay,
Yes.
Within 5 days.
Within 5 days.
Probably do it tonight.
That would be great.
How are you going to work and do
I know.
I do a lot. I'm used to it.
amazing?
Coffee is my new best friend. I never drunk coffee until I started drinking coffee probably like 3 weeks ago.
And you're from New York?
Yes.
Gonna love this.
I supervised 3 stores in New York. Faster paced, but it was fully staffed, so it was kind of easier. Here, it's like the pace is slower, but it's hard to find people that actually work. So I look at it like it's easy if I build a team. Everything is about a team, the core. So if you build a good core, everybody that has on the same page, it'll be easier. So that's what I basically have to work on. Got to talk about the opportunity that we provide. Once we provide opportunity, somebody will probably,
Also,
you know.
it's the best ice cream, so.
Yeah, Cold Stone. I ain't know anything about it until I started working there. Cake batter, I love it. I love cake batter.
Background. Mr. Poe, what's your background?
I'm African American. I was born and raised in Brooklyn, New York.
No, so how did you learn how to be a manager?
Just hard work. I'm one of those people that don't matter what I do, I try to be the best at it. If I'm scrubbing floors, if I'm scrubbing garbage, my cousin was the manager of the store in New York and Brooklyn, and just asked if anybody was willing to work. I started off as a shift leader. I worked my way up to my own store within 8 months. Then I could say probably within a year and a half, I took over as supervisor of the 3 stores. So now I'm just working
Success
out.
story.
Yeah, I'm just relocated out here because they sold their stores in New York and wanted me to stay with their company. So a bigger opportunity, more money. I got 2 daughters, so I'm preparing for their future.
God bless you.
Thank you, I appreciate it.
You're impressive. That's in the notes. You've got to give it to your boss.
Thank you.
Okay, thank you so much.
Appreciate
for
you.
coming.
Oh, that's it?
All set?
All right, I'm actually going back to the store now. Do I leave this here?
Yes.
All right, thank you, I appreciate it. Y'all enjoy the rest of your night, okay?
Good. Thank you for coming. All right. Which takes us to staff reports. Health agent.
All right, so finished up all the pools, end of August, so all the pools were done. And any questions on my report?
I don't have
Is there anything?
any. I didn't have anything.
I don't have any questions.
I had a quick question, just because it caught my eye. Is someone interested in opening another tobacco store?
I did speak to somebody, but they haven't applied. So
Okay.
we have a cap as to how many, so we have either retail tobacco stores, which are like your convenience stores and they sell tobacco products. And then we have a 21-plus tobacco store, which you have to be carded to even walk in, you have to be 21.
Right.
So our cap is, I
We're
believe,
full.
4 on those, right?
Okay.
Yeah, so
Okay.
that was the one that he was interested in.
Okay.
So- And they have to also go through the planning department too, because they have some zoning regulations, so it's kind of a two-step process for those types of tobacco.
Just Salads is opening up, correct?
That was just a special permit, so hopefully they'll submit paperwork. They kind of have to go through the process of planning, and then they usually will apply.
Okay. I have no other questions. You've had I'm looking at the number of things that you're doing there. You know, I usually give you a number, just in terms of the reviews and the phone calls, the emails, everything. It's always a huge number. So I counted 41 major issues in the last 2 weeks. So with that, could I have a motion to approve the health agent's report?
Motion to approve.
A motion by Ms. Sheehan, second by
A second.
Second by Ms. Demore, all in favor? Aye. 400. Associate Director of Public Health.
Yeah, good evening, Chairman and the board. I'd just like to highlight that we have some training for the BBRC tomorrow evening from 5 to 8:30. Evan Lynn with Maybright will be presenting on understanding LGBTQ+ identities. This is one of our DEI initiative trainings that we've got for this year, and I'm hopeful that this is going to be very informative for the folks who attend.
I've taken his course before, her course.
Yes.
His course before, and outstanding. It's 5 to 8,
Correct.
5 to 8 o'clock, so it's 3 hours, and it is outstanding. Just note that I have yet to receive a link to the Zoom.
Yep, that will be going on.
That will be going on 1 Tuesday. Is there any other trainings that you have planned?
We do. To follow on with the Maybright training, we have trauma inclusion. Ed's also going to be presenting on that. That one is in October 25th. That one's from 5 to 7. More information on that to follow. Did you have any questions about my report?
No, I don't. Does anybody have any questions?
I do not.
Brought a lot of new courses. They all look terrific. Thank you so much. Do I have a motion to approve the Associate Director of Public Health report?
So moved.
Motion by Ms. Welch, second by
Second.
second by Ms.
Andrea?
Ms. Sheehan. I'm trying to go too fast.
That's all right.
Ms. Sheehan,
I'm with you.
all in favor?
Aye.
400, thank you. Next is the Director of Public Health. Now, this includes the environmental engineer and the associate health inspector, all three. So let's start with this, under the director's jurisdiction, under her responsibility, the associate health inspector. Does we have any questions?
I just have one, Mr. Chair.
Please.
Susan, in investigations, God, my mind's just blank, wrote it down too. The Dollar Tree,
Yes.
I saw a lot of on social, so I was kind of curious.
A lot of what?
On social media,
Oh,
yes.
about the Board of Health?
No, I think
Okay.
it hadn't, I don't think it was reported to the Board of Health. It was, they were doing their own investigation.
So we did receive a complaint there. It had to do with mice, and we went out, and Samantha did an investigation and wrote an order letter to them. And they needed to fix some areas of the store where they were coming in, and also get someone out there, a licensed pesticide person, to do some work there. And they did, and they're now in compliance.
Great, thank you.
They blocked all the holes, and the case is closed.
Thank you.
Does anybody have any other questions for the associate health inspector? Let's go on to the environmental engineer, and I know there's a lot of things happening.
Yeah, so the household hazardous waste collection is Saturday, September 23rd at Fox Hill Elementary School, same time, 8:30 to noon, just for people watching out there. This is the second time at this location, so I guess it's still a fairly new location, but it worked out well the last time, so we're going to do it here again. Other than that, I think Christine's been working really hard on keeping a schedule for the hazardous material storage permit inspections. So she's been doing those on a regular basis throughout the year, and is good to finish those by the end of the year. So those are on a good track. I think that's it, unless anybody has any other questions.
Are there any questions for the environmental engineers. Except I hope you all have some time to attend the household hazardous waste and materials not to bring.
Construction materials, latex paint. Latex paint can be just dried out, put in your toter. You bring oil-based paint, bring regular oils, like for lawnmowers. What else not to bring, like things like asbestos shingles.
Asbestos shingles, flares,
Yeah.
flares, those types of, and they can go right to the fire department. So, and medical waste.
Right, medical waste, you can, we give out the small containers for sharps, and you can go to the fire department. They have a kiosk in their lobby 24/7 and drop them in there. I did just hear from the police department that they are no longer going to have the kiosk in their lobby or the prescription drug take-back kiosk, so that's going to be removed. That was something that a police department initiative, not really involved us. We run the one over at the fire department, so.
So there will be a prescription receptacle to take old prescriptions at the fire department?
There is not now. Only the police can do that type of collection, so we couldn't do that. Fire department couldn't do it there. It really has to be at a police station.
So where are we
So
going?
we're gonna need to look at, alternatives for people, where else they can dispose of it. There's like mail back programs, I believe, and things like that, but with something that we have to look into to give people alternatives. There is a take-back day that we used to do before they had the kiosk. We used to do, I don't know if you remember, but the police came to our household hazardous waste collection, and they were there, and they were taking back prescriptions, medication on that day. So it has to be on that one. There's a lot of regulations around it, so it would have to be on that one drug take-back day, and the police would have to be present.
Well, that's possible.
We'll have to talk to the police about that.
Mr. Chair.
Is there something we could do with our coalition with the other towns now? If for example,
Good
if
point.
Wilmington were offering it, could our employees go to the Wilmington Police Department, or is that not allowed?
So, nobody asks you, like, you could, I'm sure there's a website that we could put onto our website where all the take-back locations are, because, if there is one in any other town, it doesn't have to be in the coalition, a resident could go to another town, and,
Okay.
I don't think you need to be a resident of the town.
Okay,
to
I wasn't
use it.
sure if that was
Yeah,
a rule.
yeah.
But we also have your great
But that's a good
grant.
idea. What we
Yeah.
probably should do is
Talk about it.
find the website, and I know there is one that shows where the other, where these types of kiosks are located, so that people can find them if they need them. And I think there is one in the lobby of Leahy, actually. I think Leahy has a kiosk in their lobby, so that's our most
Let's look
local
into
one.
it. Let's look
Yeah.
into that. That may be good. Thank you. Maybe Leahy can come to household hazardous waste in the future. Maybe let's look into those things, because it is an important service that we do.
Yes.
So, is there anything else? We're going to town meeting, but they have the next town meeting. It will be, I guess, 2 weeks from Wednesday.
Yes.
And we have a warrant article, so I would just have everybody put that on their schedule if you could possibly make it to that. So if household hazardous waste, we have town meeting. Is there anything else coming up?
We have just some recruitment events on the 17th. Actually, our MRC is going to be doing the first aid tent at the truck day on the 17th. And then the following weekend is the Diwali festival. Mike's got some volunteers going to that to do recruitment. Yeah, that's.
Thank you very much. If there's nothing else, could I have a motion to approve the Director of Public Health report?
So moved. I just have one question, I'm sorry.
Please, go ahead.
Susan, did you mention, and if you did and I didn't catch it, it's a 12-hour day. Did you mention the flu clinic date? I know I just It was kind of usually use that at quite a few meetings before, so.
Yeah, so we talked about that a little bit last time. So what I was trying to do this year was to kind of maybe scale it down a little bit and have it, instead of having it at the schools, to have it at Grandview for vaccine that we hadn't yet given away. So we've gotten, right now, I believe we got 30 doses of the high dose and 110 of the regular dose. So we had some seniors from the senior center come up and get the high dose. We've been giving it out to employees. We had one today. Next week, we have one scheduled to do like the school employees. And then the remainder of what we have, because we won't be getting our next shipment in until October. So we have October 14th set aside for Grandview to give out to the public. That's if we get all our vaccine before October 14th. So hopefully we will. I think we will. But I haven't yet received notice as to when the rest of the vaccine is going to be shipped.
Okay, thank
Great,
you.
thank you.
Now, a motion by Ms. Welch, second
moved.
by,
Second.
second by Ms. Sheehan, all in favor?
Aye.
Before we adjourn, I would like to wish all members of our Asian Indian community Happy Diwali, which will take place on September 24th on the Common. I urge you all to attend. It's always informative and it's always a lot of fun. And second, on behalf of the entire Board of Health also, we wish our Jewish friends a happy and healthy New Year. And with that, I thank everybody. I thank our new recording secretary, Julie Falkingham, Ms. Falkingham, which is I'm going to call her from now on. I'll use your first name so people can identify you. And with that, can I have a motion to adjourn? I have a motion by
Second.
Mr. Maury, second by Ms. Sheehan. All in favor?
Aye.
That's it.
That's a
Have a
wrap.
great